Hi, everyone. Oh my gosh. I'm so excited to be here. I say it every single time, but Dana, I hope you know you are literally my favorite person to podcast with. So thank you for being here with me today. Dana, how's life? I always pull something funny out, or entertaining or off the wall. I know we just talked about protein drinks in the morning and how the day looks like after that, but how's life for you? I think you're doing a CrossFit thing. Like you've always got something wild that I'm like, oh my gosh, I love it. It makes me happy. So how are you? How's life? How's everything?
Life is good. It's busy, but I honestly, that's the way I like it. I am not like a sit still kind of person. So if I don't jam stuff in any capacity that I can, I don't
Yeah.
know what to do with myself. So
Oh my gosh. That's
yeah.
funny. I could see that. I could see that. Like saying yes last minute to a CrossFit competition with a friend because she didn't have a partner. So 2 days, it sounds like ish, couple days ish before the actual competition. You're like, yeah, sure, that sounds great. Let's do it. Yeah. I love it. I love it. Keeps your life interesting, I always say. Um, I like it, and I love our topics. I feel like a lot of times we get thrown topics and we're like, wow, let's really dive into that. Let's dig deep. And today's topic, I feel like, was one of those where we really had to think outside the box and think, gosh, okay, what can we turn this into? And we really wanted to discuss with everyone today the treatment coordinator realm. I love the treatment coordinator realm. I know you do too. I know you did a lot of treatment coordinating, and we all have behind the scenes. And I know we've been working a lot with a lot of our clients on this. I saw some trends coming up, in the last couple of weeks and chatting with doctors and treatment coordinators and office managers that we've been working on. And I thought, Dana, your ideas were fantastic too on the treatment tracker. So you guys, we're going to just talk about how to level up the treatment coordinator position. So whether you're a treatment coordinator, an office manager, or anyone who delivers treatment plans, or you're the doctor who's like taking this back to your team, I think this will be really valuable information. What we try to do for our clients and for you guys is to really pull in that third party perspective and see, these are the things that you're doing. How can we add to it? So how can we level up what you're already doing that's working, or not working? Sometimes it's not working, but how can we level up what you're already doing and add that extra piece in there, that extra value to get a different result? So today we're really looking at that. And some of the pieces, Dana and I went through ahead of this, and we thought, well, we want to make sure you're doing the pieces that you should be doing that we've already talked about. So you'll be able to find podcasts on your follow-up routine. Your 222 is what we call it. 2 weeks, 2 months, 2 days, 2 weeks, 2 months. The 222, all of those pieces, your blocked scheduling, your scheduling to production, like all of those things, your follow-up calls, your in-office treatment plans, talking about insurance last, those are things that we've talked about before. So now we think, okay, how do we layer on top of that? And before we dive into some of the ideas that we talked about, Dana, I really want you to talk about the treatment tracker and what you just said. So I'm hoping everyone listening is like, I know what a treatment tracker is because you guys talk about it all the time and you've implemented it. I know most of my practices are utilizing manual treatment trackers. So I hope you guys are too, because what Dana has to offer here is actually brilliant. Like it's so smart, and really looking at how that treatment coordinator position can level up. So Dana, I'm going to give it to you. Like, tell me a little bit more, or recap for me what we were just talking about on that tracker. I thought it was really smart.
Yeah, sure. I always tell my treatment coordinators or just clients in general, I never want to give you something that it feels like I'm just entering the data, right? Because you can enter the data, but you need to take away something
Yeah.
from doing it. So anytime I implement the treatment tracker, I want my treatment coordinators and oftentimes I'll have my doctors do it with treatment coordinator. And that is look for trends. Your treatment tracker will tell you so much about your treatment presentations, about the barriers to care for your patients. And so routinely looking and seeing what trends do you see? Do you see trends in specific services? Like, are you really great at doing SRPs and fillings, but you struggle with crowns or implants, right? Your
Mm-hmm.
treatment tracker will show you that. If you struggle with specific dollar amounts,
Yeah.
so meaning we're really great at doing anything $2,000 or under, but as soon as it gets to 2000, right, we struggle. Okay.
Yeah.
Two, looking at if you've got more than one treatment coordinator. if you've got like one trend for another, have them train and work on their verbiage with the other team member.
Yeah.
So it's looking at that treatment tracker and saying, okay, what areas should I, do I need to level up in? And then be proactive and find ways to train. If you say, hey, I'm struggling with implants, go watch an implant. Have the doctor walk you through how they explain an implant to a patient. Okay. If you're struggling at certain dollar amounts, look at your financial options. Right?
Yeah.
One, is it just a barrier that you have going into it? Or two, do we need different financial options for our patients once we get to that point? So reviewing
Mm-hmm.
your treatment tracker weekly for trends like that is just an automatic way for you to be able to find training that you need and level
Yeah.
yourself.
I love that. You said that earlier when we were chatting, and I was like, yeah, that's brilliant. And we do train our clients to look for those things, but it's not something I think that everybody really truly goes back and does. And looking for all those trends, and in addition to what training you might need as a treatment coordinator to level up, it's also going to show you trends within the practice, right? So do you have an associate doctor that kills it with implants, but an associate doctor who can't sell an implant, but really wants to do them? There's training there, or handoffs from your back office. Like your treatment tracker, I think treatment coordinators, when I deliver it, often think, great, she's going to be evaluating me and I'm getting a grade. I'm like, yes and no, like yes and no, but I'm really looking at full practice, and you're the person who's able to put that data in so that we can see the full practice success. You get to be the leader in that success. As the treatment coordinator, like Dana is saying, you have the ability to look at this tracker from a different point of view, from that bird's eye, like pulled out point of view, and you can look at it, delete any thoughts you might have about it, and just think, what are the things that I'm seeing here? Can I help my team level up? Can I level up as a treatment coordinator and be a leader in progressing our training for the full team? So I thought that was so special and so brilliant. And we can dive more into that either later, or you guys can always reach out. We do have a lot of clients that reach out for treatment tracking and all of that information, but really look to see all of the different spaces. So Dana, I think let's paint a picture of a tracker, right? And I'll paint a picture, and this is where it gets fun, you guys, because you can utilize anything you want. Your tracker can be whatever you want it to be. So I'm going to paint a picture of one of my favorites I use for a lot of my clients, and then I want Dana to paint a picture of her tracker, because I bet you they're super similar, but they're actually different. And you guys were both dental team, so I guarantee they're going to be different in some way. So the tracker, the things that I like to track on my tracker are going to be the patient name, obviously, the date that we saw them, the hygienist who saw that patient, if a hygienist saw them, the person who delivered the treatment plan, and then I like to section it by doctor. So you can either have it like, your owner doctor at the top, and there's his or her section, and then underneath you've got a separate section for your associate, or you can label them. Again, I like to put those little boxes in there that you guys can do multiple choices on, so you can do the doctor as well. And then we're going to put in there the full treatment plan amount. So what did I treatment plan today? Now, here's the caveat. If my doctor comes to me and says, hey, we've got $20,000 worth of treatment, but we're starting here, I only want you to present the upper right. That's where we're starting. That's what I'm tracking, because that's all that I could sell today. That's all that I could have gotten case acceptance on. I was limited on that 20,000 and only given that upper right amount. So on your tracker, you're going to then track your net amount for what you presented. I get this question a lot, Dana, you probably do too, where people are like, okay, am I tracking gross or am I tracking after adjustments? You are tracking whatever you could have collected. So 100% of whatever you could have collected is what you presented. So you're going to put that under your presentation, and then you're going to put the next column over. We'll say how much was actually accepted. And then if you do the calculations right, or the formulas right on your Excel sheet, it'll tell you the percentage. So I have all of those in there. And then I have a little space over here that says notes if they didn't schedule, but it'll track it. You can do it by week. You can do it by month. You can do it however you choose to do it. But the trends within there are what are key. So Dana, what is your tracker? Walk me through what your tracker might look like. Again, probably super similar, but there's probably a variance. And then let's just shoot off a couple of trends that, in addition to what you already said, they might see.
Yeah, sure. So mine looks very, very similar to yours. It has the patient name, it has who they saw that day, it has who's presenting the treatment. I do have a column though for like basic of what the treatment is. So like crown
Oh,
or
perfect.
bridge,
Yeah.
crown SRP, right? So I have a column that says like
Right.
what type of treatment is it? Then I have the amount of doctor treatment, the amount of hygiene treatment, the amount that is accepted. And I also in my treatment tracker do all of my follow-up tracking. So I have a
Yeah.
2-week column, 2-month column, 2-day. We keep
I know
missing
I
that
did
one
it
today. I
earlier.
don't know why. 2 day, 2-week, 2-month in
Yeah.
there so that everything is accessible in one place. And just to help consistency. And
I
then
love
I
that.
also have a column for if a patient didn't schedule, why. Because
Yeah.
when you make your follow-up call, I want you to remember why they didn't so that you can
Yeah.
ask about it, check in, see where they are.
Yeah, that's brilliant. I love that. And I do have a few that have that 222 on there. I think that's smart. And I love that you do that because one piece that is super helpful, I think, is if you have the follow-up requirements on there, you can plug in the dates that you, so if today's Friday the 10th, right, or 9th, Friday the 9th, whatever it is, you're going to follow up on Tuesday the 13th, right? So I can look at a schedule and know when am I going to follow up with this patient, and I can put the dates in those columns. And then on Excel, you can do the find button and you can type in that date and it'll automatically highlight all of those dates for you. So it makes the follow up super simple. So I love that. Some of the trends that I like to look for, that I like my treatment coordinators and office managers to be looking for on that tracker, are going to be, number one for me is case acceptance. Obviously, we want to see where your case acceptance is for the full practice. And then number two for me is the diagnosis amount, ensuring that our doctors are diagnosing what we need them to in order to fill a schedule. And we need like 2 to 3 times our monthly goal in order to say we could easily and successfully fill a schedule at a 50 to 60% case acceptance rate. So those two pieces are really huge for me. Then I like to dissect it and see, of that diagnosis, where's my doctor's splits, right? So is my owner doctor carrying 75% and my associate doctor is 25%, or vice versa? Are they split evenly? Then I like to see, okay, well, maybe my associate's at 25%. And I'm like, dang, I need you to work more. And their associate's like, okay, cool, Tiff, but like, I don't see new patients. Well, that's a problem. So if you see something, you want to take it that next step. That's the leveling up. So if we see a diagnosis is low or a case acceptance is low, why? Why is it low? It can't just be the arbitrary, like, make it better. I know we used to work like that. I know when I was a treatment coordinator, it was like, your case acceptance is low, do better. And I'm like, okay, I don't know what that
Yeah.
means. I don't know what it means. So then it's looking at it and seeing how many opportunities did my doctor get, and did my doctor use those opportunities wisely in case diagnosis. And then, Dana, have you seen it? I've seen a trend recently where it's like, well, the patients that I'm getting are super clean. And so I have a doctor who's in Pennsylvania, and he's done a couple podcasts with us, but he's near a college. And so he doesn't have a lot of older patients. So he doesn't have a lot of SRP, right? He doesn't have a lot of perio going on. So he's like, Tiff, we can't reach this 30% right now. I'm like, okay, well, now we'll work around it. So Dana, those are my top two. I know you spoke to like looking for financial pieces. Is there anything else you can think of off the top of our heads? This is literally off the cuff, you guys. We talked about case acceptance, we talked about diagnosis, and then also looking at those amounts. Is there anything else you can think of that would be exceptionally important for the tracker?
No, I think those are the heavy hitters that I usually have my practices look at. Yeah.
Yeah, yeah, I agree. I agree. And tell me, what do you think about, well, what is your favorite way to do follow-up? Because I think the follow-up is a good way to level up. And we've got the 222 tracking. And if you guys don't know what that is specifically, there are podcasts for it, or reach out to us at hello@thedental18.com. We're happy to share it with you. But you utilize the tracker. Now, how do you want that to look? Like, what are they doing? How can they level up their follow-up within their practice?
Yeah. So I love that you said put the date in there and then pull the date. I think that's an easy way. I think oftentimes so much follow-up comes when we have holes in our schedule and we're like,
Hmm.
oh, we have to fill, like,
Yeah,
let's pull anybody that we know. Let's now look at our treatment tracker. And really my biggest tip for leveling up follow-up is consistency and
yeah,
making sure that anybody that didn't schedule, you're remembering why they didn't schedule, you're calling to follow up on that, and you're asking them, even if you don't get the schedule, right? Because your
yeah,
outcome is they either schedule, right? They say they still have whatever barrier it is,
yeah,
or they're not interested, right? And if we don't get a not interested, then hey, can I follow up with you again, right? Always making sure that you've got your next touch point and that you're keeping it super, super consistent, because that's where I see offices trend is just, well, I use it when I need to fill my schedule versus I stick to consistently and routinely.
I totally agree. I think that goes into recare as well. I've been talking a lot about that because I have so many practices that are like, Tim, we don't have anywhere to put them. I'm like, okay, but they're not answering right now. So your touch points are making it so that when you do have a place to put them, you do have that hole in the schedule, they're ready to schedule. And I think it's the same thing with that. If you don't talk to a patient for 6 months and you try to catch them at their recare, it's going to be a lot harder to grab that than it would have. I love it. Okay, so that's the tracker, you guys. I think there's a lot of leveling up that can be done within the tracker. There's a lot of things there that can be seen and that can be pulled out. Now, follow up is key. The 222 or whatever it is that you guys decide to implement. We love the 222. I have a practice on. I talked to her on Tuesday, and she goes, actually, I added another two, so we have the 2222. And I was like, okay, that's cute. So she does 2 days, 2 months, 2 months, or 2 days, 2 weeks, 2 months, and then an additional 2 months. So it's technically 4 months. Yeah. I was like, oh, that's cute. That's cute. So I was like, I'm never going to tell you to decrease the amount of times you're outputting information. I will always make you increase. So you're on track. But a couple of other things that I've been working with a lot of practices recently on is really it's new patients and marketing has been really huge the last 6 months, I feel like. And trying to find those spaces where marketing's doing their job, new patients are coming in. Sometimes it's slower than we want it to be, but how can we squeeze as much as we can out of the fruit we already have? So I think of like making your own orange juice, right? That's tedious, takes a lot of work, and you've only got so many oranges and you're trying to make this much orange juice. And if you're like half-see squeezing the orange and then tossing it away because you're like, yeah, it's to the rind, I'm done, and then half-see, you're not going to have enough orange juice. But if you've got the oranges and you're really juicing that orange until you get all of that juice out of there, you're going to have more orange juice. So I think of the patient base like that. This is a fruit we've worked really hard to get. It's hard to grow fruit. It is incredibly difficult. Okay. Unless you're in Florida and you've got oranges everywhere, it's hard to do. So we're working so hard for this fruit coming in, but we're letting half the fruit go and throwing the rind away and never thinking about it again, but buying another orange. So I started thinking, okay, well, how do we think outside of the box on this? What are things that maybe practices are looking at or maybe they're not? And these are some ideas that we've come up with, and I hope that they work for you guys, that it's easy to implement. One of the pieces I think that often gets missed are specialist referrals. We refer the patients out and we're like, okay, fantastic, go get that root canal, go get that implant, go get that consultation or evaluation, and you let us know what they say. And then their cleaning comes up and we're like, did we refer you for that already? Like, I feel like I did. And they're like, oh yeah, but I didn't go yet. If you'll give me another one, I'll go this time, I swear. So Dana, like, how would you follow up with that? Because I think there's a lot of lost opportunity or missed opportunity with patients that get sent somewhere else.
Mm-hmm. Yeah. So usually the way I do it is, again, I think these are people you can add to your treatment tracker, right? And a
For
lot of times
sure.
I'll color code, right? So you could color code that like for referred out, right? I like new patients to be color coded too. So you can color code that patient. And then usually what I say is the same thing as that, like that 2 day, 2 week, 2 month, right? 2 days later, I'm reaching out to the specialist to find out if they scheduled. If they didn't, then 2 weeks later, I'm reaching out to the patient to check with the
Mm-hmm.
patient to see if they've scheduled, because
I love that.
ultimately, right, there is care that then they're going to return to my practice
Correct.
for, right? And I think we just miss those things. We miss
Yeah.
the like, well, we sent them, and so now we're waiting for that letter, and our
Yep.
only proactive thing we do is scan that letter in when it comes in, give it to the doctor, right? And then we
Yes.
schedule treatment. But what about those patients who never went in the first place? Right?
Mm-hmm.
We're still waiting to do that endo restoration, right? We're
Yeah.
still waiting to do that implant crown, but the patient never went and did that portion. And I do feel
Yeah.
like that's definitely a way to level up our care, and that like, hey, I'm really concerned. We referred you out for this. I'm going to check with the referred person. Nope, we didn't have that. Now I'm going to go to the patient. Okay. So then my
Mm-hmm.
next follow-up call is with the patient, because truly, right, we need you to do that step to be able to do our step, and we know you need it.
Yeah. Agreed. Agreed. I love that. I love that you add it to the tracker. That's what a practice of mine this week said they do. And then also treatment coordinators, as Dana is talking, I'm thinking you wouldn't have to do that 2-day follow up if you scheduled the appointment with the patient there in your office. So I know a lot of practices have really good relationships with their specialists, and oftentimes you can get an appointment for your patient that your patients can't get for your patient. So if you've got a couple minutes and you really want to ramp up that relationship with the patient, calling the specialist with them there and helping them to schedule that appointment is super beneficial and really helps all of that relationship. So I love that. Another one that I thought of just real quick and then we'll wrap, but we have so many emergency new patients that come through the door, right? Or so many patients that have only ever been seen on a limited basis. So that 0140 comes through and we're like, okay, well, you call us when you're ready to come back. You call us when you've got more issues, or you call us for that new patient appointment. We're not always converting them in the practice, which that's key number one. Try to convert them. You can convert them over the phone, right? Well, let's take a look at everything, honing in on this specific problem. Can we convert that limited emergency appointment into a comp? We have an opportunity chairside to convert them into a comp with x-rays, but then also treatment coordinators for an office, whomever's making these calls, you can pull out of your system a list of patients who have had that 0140 and then check to see, have they had their comp exam yet? Have they been in? Because if they haven't, that's a great follow-up tool to just check in and say, hey, how are you doing? I know you had that pain and that tooth that we fixed last June. I'd really hate for something else to come up. Let's get you in and just verify that everything else is doing okay. We don't have anything brewing so that we're in an emergency situation again. And I think that's a great way to help boost up your quote unquote new patients. They're not new patients yet, or they're not new patients anymore. They were already a new patient, but now they're a comp, and it'll help ramp that up. That's what we need our new patients for. So I think those are all fantastic ways to really level up. Dana, I think your treatment tracker, that was beautiful. Thank you. That was so smart. There's so many things to dive into in there. So I think takeaways, go review your treatment tracker. Number one, if you're not using a tracker, implement one. Contact us if you need it. All of our clients use them. They're fantastic. So you can reach out to us, hello@thedentalAteam.com. We'll set you up. We'll get you some info. If you're using a tracker, which I hope you are, go review that tracker. I want you to go review it today. I want you to look at it, and I want you to find two trends that you can see right away. I don't care what they are. It could be your case acceptance is high. It doesn't have to be a negative trend, but I want you to find two trends that you see right away so that your brain starts working on it. I want you to think about the financial options that you have available in the practice. Dana mentioned that, and really being able to open that up to see how many patients we could help. So find two trends on your tracker, review your financial options. Do you need more, or are you set? And then I want you to consider the specialist referrals. How are we going to keep up on track of those if we're not already? And then that 0140, so getting that limited exam turned into a comp. So you've got 4 action items, you guys. Dana, I think I snagged it all. You know, I take notes. Is there anything you can think of that I missed in my recap?
No, you got it. And I'm excited for this podcast. It was jam-packed, Tiff.
Oh my gosh, I agree. 25 minutes of a ton of stuff. So I think, thank you. And thank you for adding so much value, Dana. I think if you were driving like me, I'm usually driving, listening to podcasts, replay this when you get to the office or when you get home, and take some notes, because it was jam-packed. You're right. All right, everyone, go do all the things. Again, reach out to us, hello@thedental18.com. Drop us a 5-star review below. We like to know that this content is good, that you loved it, and that it's implementable for you. And we like to make sure that other people know that as well. And that's the best way we know how. So till next time, thanks, guys.